Minister Donnelly, can I begin by welcoming you again into the House. It's always good to have the opportunity to address you in person. I acknowledge that your job is no easy task at the best of times, not to mention under the circumstances since you took office. You inherited a responsibility for a health service that had for years suffered from a lack of capacity in key areas such as ICU. I note that the Taoiseach and his government had ignored pleas to expand capacity in these areas, a failure that the nation has been paying a heavy price for over the past 13 months. Need I mention the National Children's Hospital project that has been plagued by incompetence, delays and skyrocketing cost overruns? I can empathise with you on that front. However, we are well over a year into this global pandemic and our healthcare system is in turmoil. Our national debt is ballooning. People have lost jobs and been put on PUP. Businesses are on life support. Our children have lost out in invaluable time in education, and all of our lives have been continuously put on hold for the past 13 months. The scale of the damage being done to people, to their mental health and physical health, and to the country is incalculable. I have heard anecdotal reports of suicide and domestic violence on the rise, women and children being trapped with their abusers for months on end with little and no relief. Families have been deprived of the ability to attend the funerals of loved ones. Their grief has been amplified. Public worship has been outlawed in a most cavalier fashion without the body of solid empirical evidence to support it. The same can be said of construction. The cessation of construction is exacerbating the housing crisis and the chronic economic crisis. NPHET from their ivory tower have force-fed the public on a daily basis a diet consistently of crude COVID statistic fear and admissions. Hardly a diet conducive to good public health, mental or otherwise, might I add. NPHET will be better served the public by the adoption of a holistic approach, a nuanced strategy that took account of all aspects of public health, short, medium and long term, as well as societal effects on their dictates. I distinctly recall the CMO saying that it was not his job to consider the consequences of his advice and that another body should perhaps be set up to do this. Well, Minister, I think that body is called the government. This government, as well as the previous one, has totally abdicated the responsibility of making decisions to govern. As the Taoiseach, in an interview with Claire Byrne, said NPHET's advice had been thought through and they had no answers to obvious and valid questions regarding the consequences of their advice that he had put to them. Regarding consequences, the Minister and the Government need to take note. The Irish Hospitals Consultants Association is predicting that almost 1 million people will be on hospital waiting lists by the end of this year. These are people with serious life-threatening conditions, cardiovascular disease, cancer and many other painful, debilitating diseases. The life-threatening wait for treatments is set to get worse, with 700 hospital consultants' positions remaining unfilled. Consultants say that more beds and more staff are desperately needed to deal with over 900 inpatient and outpatient hospital appointments that have been cancelled in order to focus on COVID. Consultants have criticised the HSE's approach to mental health, the e-health technology project, recruitment, ICU capacity and equipment. The allocation of 1% of additional COVID spending to mental health is grossly inadequate, according to Professor Irvine. In light of this appalling vista, and I've only described the tip of the proverbial iceberg, the question I'd like to say to you: when are you going to admit that you are out of your depth? We're at a point in this crisis where we need a Minister for Health who is willing to fight to get vaccines for the people of this country. The Department of Health and the HSE are about as dynamic during the vaccination rollout as a ship beached at the Suez Canal. It is simply unacceptable to sit and wait and continue to wait for the European procurement system to deliver the vaccines our people urgently need right now. We need somebody who will act with a sense of urgency, who will provide much-needed clarity and leadership. Minister, this is your first role in any government. I put it to you that you have lost the trust and confidence on account of your mismanagement of this crisis. The poor communication from you, the mixed messaging, the never-ending doom and gloom, the taxpayers' money squandering on a failed tracking and tracing system, the entire year stalling a mandatory quarantine and PCR testing for foreign visitors arriving into our country. Reports indicate that up to 10,000 a week.
You're over time.
Sorry, I'm just going to finish in this paragraph. Meanwhile, Irish people cannot stray 5 kilometres from their own homes without fear of being stopped by Gardaí or being asked for a reason to do so. I will continue later on. Thank you.